Hello, my name is Dr. Kamran Bhopal, and today I'm going to quickly show you how to perform a PR examination or a per-rectal examination. I will also be telling you the findings of the prostate in this examination, and at the end of the examination I'll also be showing you different models and different findings that can come in a mannequin and also present in a real patient. So now, performing the examination on a real patient, ideally I would introduce myself, greet the patient and check the identity of the patient. After doing all this, I'll explain what I'm going to do. So I'll explain that I'm going to examine the gland at the base of his bladder with one gloved, lubricated finger. And then I'm going to walk towards the glove set, wear a set of gloves. I will ask the patient to lie down on his left side with his knees bent and thighs as far as possible towards his chest. So the patient will be lying like this. This will be his legs, his hips, and this will be his head on the left side. After that, I'll ask the patient to expose himself. And after that, the first thing that I'll be doing in this will be the inspection. I'll come to the level of the patient. I'll look for any discharge, redness, swelling, scar marks, any anal fissures, any external hemorrhoids. There are none in this patient. I'll ask the patient to strain to check for any rectal prolapse. After that, I'll take some gel, put on my hand and place my hand on the anal sphincter. I'll warn the patient that he'll be feeling something cold. I'll place the pulp of my finger on the anal sphincter for about 30 seconds for his anal sphincter to relax. I'll check for the comfort of my patient at all times. After about 30 seconds, I will gently insert the finger inside the patient, very slowly, check for the comfort of my patient. I will check for fecal impaction. There's no fecal impaction in my patient. I'll ask the patient to strain again to check for any rectal prolapse. After that, I'll check the right lateral wall of my patient, and there's no abnormalities and no masses. The posterior wall is free of any abnormalities and there are no masses. The left lateral wall is free and there are no abnormalities. There are no masses. On the anterior aspect, I can appreciate the prostate. It has two lobes which are normal in size. The surface is smooth. The medial sulcus is normal, and the anterior mucosa is free and there is no abnormality. So these are the findings of a normal prostate. I'll be gently removing my finger, and at that time I'll be asking the patient to squeeze my finger to check for anal tone. And then very gently take the finger out, look for any bleeding or discharge, and offer wipes to my patient. And after that, I will cover my patient. So this was a normal prostate examination. I'll now be showing you different models of the prostate exam and different findings that can come in an OSCE exam and also in real life when you're examining the prostate of a patient. So these are the different models of the prostate, and any of these findings can come in an exam or in a real patient. So the first one that I'm going to show you is the normal prostate. This goes inside the model, and as you can appreciate that both the lobes are normal in size. The median sulcus is not deep, so which is normal. The surface is smooth, and you'll be able to appreciate when you're examining via the mannequin that the anterior mucosa will also be free. In a real patient, the patient might be tender as well, so that shows some abnormality. So that's also a thing to see in a prostate examination, and that is the reason I was continuously saying that I will check the comfort of my patient. But coming back to the model, so a normal prostate will have normal sized lobes, and you'll be able to compare them when I show you the abnormal sizes of the lobes, and you'll see that the median sulcus will not be very deep. So that's a normal prostate with a smooth surface, normal sized lobes, and a normal sulcus which is not very deep, and free anterior mucosa. Coming to unilateral benign prostatic hyperplasia, you can see that one of the lobes is normal, whereas one of the lobes is quite enlarged. So you can appreciate the difference between an enlarged node and a normal lobe. An enlarged lobe and a normal lobe. And you can also see that the median sulcus is slightly more deep as compared to the normal prostate. The surface in a benign prostatic hyperplasia will also be very smooth, and the anterior mucosa will be free. So that shows that this is a unilateral benign prostatic hyperplasia with one enlarged lobe. Coming to bilateral benign prostatic hyperplasia, it's the same as the unilateral benign prostatic hyperplasia, except that both the lobes will be enlarged and the sulcus will be quite deep. So both the lobes are enlarged, both the lobes are smooth, and the sulcus is quite deep. The anterior mucosa will still be free. That is a bilateral benign prostatic hyperplasia. Now coming to cancers. So now I'm showing you the unilateral carcinoma of the prostate. So as you can see is that you will appreciate an irregular surface of the lobe on one side. So this is all irregular. You might be able to appreciate the medial sulcus. Sometimes you might not be, because the lobe might be so irregular that it confuses you with the median sulcus. And you see that the other lobe is smooth and normal in size. So this one is a unilateral carcinoma of the prostate. This is a bilateral carcinoma of a prostate. You'll see that there's no differentiation between the right and the left lobe. It will be all irregular, all over the place. There will be no sulcus, there will be no differentiated lobe, and it will have a very irregular surface. And that says, and sometimes the anterior mucosa might also not be mobile in this certain case in real patients. Probably you cannot mimic that in a mannequin, but in real patients it might not be mobile. So if it's an irregular surface, medial sulcus cannot be appreciated, then that is a bilateral carcinoma. I hope that you've enjoyed this video. I'll just show all of them again. So that's a normal, that's a bilateral benign, that's a unilateral benign, and this is a bilateral carcinoma, and this is a unilateral carcinoma. I hope that you've enjoyed the video and learned from it. Thank you very much.